The innovation of technologies nowadays plays a great role in making lives easier and convenient. Inventions which simultaneously exist have led to the complexity of industry. This was the medical imaging 1985. The only way to look inside the body was to cut or to open it, and first X-ray image in 1895. It revolutionized the way of diagnostic medicine without opening it up. The computer tomography or the CT scan, the ultrasound in 1959. This is the MRI in early 1978, one of the first images of the abdomen. MRI stands for magnetic resonance imaging. You will see some remarkable images produced by this type of medical imaging exam. These are the medical images of the brain. They are steadily cleared and detailed. Here, in addition to the brain, we can see the spinal cord, sinuses, teeth, and even blood vessels. Here's what MRI makes so different from other medical imaging techniques, such as conventional X-rays and computer tomography, known as CT scans. Let's see. X-ray devices are generally used to take projection images of the hard tissues like bones. CT scans take images to both hard bones tissue and soft tissues such as brain. Both X-ray and CT systems use X-ray beams which travel to the body and project an image into photographic film or displayed on a video monitor. MRI, on the other hand, works differently. MRI uses magnetic field to orient the position of certain nuclei ion in the body. The primary nuclei used for MRI imaging is a hydrogen atom called proton. As you know, the body is made of approximately 75% of water. Water is two parts of hydrogen, making nuclei accept the hydrogen atom, the proton, the most abundant in the human body. A radio wave is then used to excite the proton, which resonate and emit varying signals which are received, digitized, and displayed as images. Different signals submitted by different body tissues are then used to differentiate individual anatomy. When tissue is damaged, its composition changes and gives off uncharacteristic signals. It's distinguishable from surrounding healthy tissues. Once again, it is important to point out that MRI utilizes magnetic field and radio waves. Patients are not exposed to X-rays or other ionizing radiations. On the day of your examination, you will have first to sign for the patient information record and allowed to undergo pre-examination screening. At that time, you may be asked some questions to make sure that you are eligible to undergo MRI examination. For instance, patients with metallic formed bodies or has surgically implanted devices like cardiac pacemakers and aneurysm clips are not eligible. These devices are maybe adversely affected by magnetic field. Object contains ferrous metals will also interfere in obtaining a good MRI image. Therefore, it is advisable to wear a sweatsuit, clothes pants, or garment provided by the imaging facility. Prior to the start of your MIR exam, the technologist will explain the procedure to you and address any concerns you may have. Once inside the MIR room, you'll be asked to lay on your back. The table will then rise. Because the machine is noisy, you'll be given some hearing protection, in this case, an earplugs or a headset. You will be given a call bell just in case you need to stop the testing or need to talk to the technologist. You will be gently positioned and secured on the scan table. your head will place into the center of the machine. It is important that you will remain still because even the slightest movement during the exam can blur the picture and result in the need of repeating the scan. You will hear humming as the equipment generates the images, and you will feel a slight movement of the table as gently positioned to you for scanning. The technologist will have you in a full view at all times and will remain in constant communication with you through two-way microphone. This exam usually takes 15 minutes. This is an optical illusion brain test. Are you a right brain thinker? Or are you a left brain thinker? To check that out, which way is this woman twirling? Now, if she's turning clockwise, then you are a right brain thinker. But if she's turning counterclockwise, you're a left brain thinker. Right brain thinkers are random, intuitive, holistic, synthesizing, subjective, and they look at the whole picture. On the other hand, the left brain thinkers are logical, sequential, rational, analytical, objective, and looks only at the part of the picture. There are some people get hurt to twirl either direction, but the big question is, what kind of thinker are you?